Hello and welcome to Physioalchemy. Today we are going to talk about the detailed anatomy of your knee joint. Okay, so as you all can see on your screens, what I will cover is, first of all, we will cover about the type of joint. Okay, so what kind of joint this is, about the knee joint. Then we will be going to talk about the bones involved. So what are the prime bones that are involved in the forming of your knee joint. Then we will talk about the beautiful articular surfaces that is present on the femoral aspect as well as on the tibial aspect. Then we will cover the ligaments, in which I have divided in two terms, which is your extracapsular, they are different, and the intracapsular ligaments are different. Then we will talk about the menisci, then muscles around the knee joint. So I will be talking about the anterior compartment, posterior compartment, and the lateral compartment as well. Then we will be going to discuss and see some videos about the movement and the motions which are available in the knee joint, and in the end we will be discussing about the various bursae which are present in the knee joint. Okay, so without any further delay, let's start. So now let us discuss the type of joint. So first of all, if you're talking about the type of joint, it is your bicondylar, okay, hinge joint. It is a bicondylar hinge kind of joint. So why bicondylar? So bi means two, so we have two condyles over here, okay, and condylar means the condyles, like we discussed. So it is a bicondylar kind of hinge joint. Now the hinge joint that allows only flexion and extension, and at the some point of view, if you are looking at the knee joint, it also allows the external and internal rotation. So we'll be talking about the motions in the upcoming video, okay, below the slides. Now type of joint, so we also have to mention whether it is a synovial joint or a non-synovial joint. So knee joint is a synovial joint because we have synovial fluid and the synovial membrane around the knee joint. Okay, so now we will discuss what are the bones involved in the knee joint formation. Okay, so many of the students make mistakes while mentioning the fibula as well, but fibula is not a part of your knee joint articulation. The articulation is formed by the distal femoral condyle, patella, and the proximal tibia. Okay, so again I am mentioning, so the joint is formed by femur, patella, and your tibia. Okay, so you see here we have is the patellofemoral joint, which is in between the patella and the distal femur. Let me show it to you here. So as you can see, this is your patella, okay, this is the retropatellar space, which is the space behind the patella, and this is the distal femur. So this is your retropatellar joint or the patellofemoral joint. Then we have is the true joint formation between your distal condyle of the femur and the proximal condyle of your tibia. Okay, so this is the articulation of the knee joint. But again, we cannot spare the fibula. Fibula is also having some kind of role. So whenever we talk about the entire knee complex we are talking about, not the joint. So in that we have three articulations. First of all, as we discussed, patellofemoral. Second one is your in between your femur and the tibia, which is your tibio-femoral joint. And then we have is the proximal tibio-fibular joint. So fibula head and the lateral surface of the tibial condyle, they are forming a joint which is your proximal tibio-fibular joint. So these are the three important joint aspects that we talk about in the knee joint, but the articulation is in between these three bones, always remember. Now before moving towards the articular surface, I would also like to teach you about the bones and the midline of the body. How you will decide which part is the medial part and which part is the lateral part of the knee joint. So it is very easy. So as you can see, this is your femur. Okay, this one is your femur, like this. This one is your patella. Okay, this is your tibia, and this is your fibula. Okay, so these are the 4 important bones in this region. So if you look at the image, here we have both the knees. So this is the midline of the body. So if this is the midline of the body, so this will be the medial surface of the knee joint, and this will be the lateral surface of the knee joint. Why lateral? Because fibula is always lateral side. So fibula is always present on the lateral aspect of the knee joint. That is why this is your lateral side of the knee joint. Now if you can see in this image, we are able to appreciate the entire femur. Okay, so this is the distal femur. Distal means below region. So the lower region is the distal part, and the above region of the tibia, this is known as proximal. This is proximal tibia. Okay, so this one is your distal femur, and this one is your proximal tibia. This is your proximal fibula. Okay, and this is the retropatellar space. Retro means behind. Okay, so this is your retropatellar space, and this is your entire patella bone. Okay, now in this image, as you can see, we are looking at the knee joint from posterior aspect. Okay, from behind. So this is the behind the knee joint. We are able to appreciate these structures, but again, do not focus on the menisci and the ligaments. We will be talking about this in a very detailed manner in the upcoming slide. First, just focus. As you can see, this is the distal femur. Okay, this is the lateral condyle, and this is the medial condyle. Why lateral? Because fibula is present on this aspect, and this is your medial femoral condyle. Okay, so let me mention it. This is your medial femoral condyle, and this one is your lateral femoral condyle. This is your lateral tibial condyle, and this is your medial tibial condyle. Okay, now above the condyle we have is the plateau. Okay, so this region is the plateau surface. So this is again very easy. So you will mention it as medial tibial plateau. Okay, and this one will be your lateral tibial plateau, and there we have is the fibula head. Okay, so this is the posterior aspect of the knee joint on the both aspects. So similarly on this region or on this knee as well, this will be the medial tibial condyle, and this will be the lateral tibial condyle. So this is the condyle region. Okay, this is your entire condyle, while the above surface, this one, let me draw it again, this surface is the plateau. So this will be your medial tibial plateau, and this will be your lateral tibial plateau. Okay, now as we are moving forward, we are going to discuss about the articular surface. Now what is the articular surface? Articular surface is those surfaces which allow the joint formation. Okay, so on the distal aspect or the below region, this is your articular surface of femur. Okay, so again let us find the fibula. So this is the fibula present. That means this is your lateral femoral articular surface, and this will be your medial femoral articular surface. Okay, and this will be your lateral. Now similarly, this will be the medial articular surface of the tibia, and this is your lateral tibial articular surface. Okay, so these are the articular surface, the smooth boundaries that allows the pure friction free movement, at the same time allows the articulation of the bones. Okay, like femur and the tibia. Okay, now one thing, if you have noticed, in the tibial aspect we have two mountains over here. Okay, so this is known as your tibial spikes. This is your tibial spikes. Okay, like this one, and the space above the tibial spike, it is known as your intercondylar notch. Okay, so inter means in between the condyles. So these are the condyles. In between the condyles we have is the intercondylar notch. Okay, now we will be moving forward with the other slides, which is your patella. So now we are going to discuss about the patella in a very detailed manner. So first of all, as you can see, this is your entire patella. Okay, this is your patella. Now the above surface that you see, this is the base. Okay, this is known as base of the patella, while this triangular surface is known as the apex. Okay, this is the apex. Similarly, behind this patella, okay, if we talk about the posterior region of the patella, as this is the anterior surface, here we would be having a small medial facet, and in this region we would be having a lateral facet. So this is your medial facet, and this will be your lateral facet. Now let us learn about what are the prime features of the patella. So first of all, patella is the largest sesamoid bone in the human body. So what is a sesamoid bone? A sesamoid bone is a kind of bone that gives attachment or the origin for different kind of tendons. Okay, now if you look carefully at the knee joint, okay, if this image we would be talking about, so what you will notice, here we have is the quadriceps tendon. Okay, and this is your patellar tendon. So if you can notice, the quadriceps tendon is attaching to the base of the patella, and from the apex it is your patellar tendon. Okay, this is your patellar tendon, and this is your quadriceps tendon. Okay, so a sesamoid bone gives attachment to the tendon. Okay, now again back to the patella. So it is the largest sesamoid bone in the human body. Now the second point says that it is embedded within the quadriceps tendon and continues as the patellar ligament. So not the patellar ligament, but we would call it as patellar tendon to the tibial tuberosity. Now where is the tibial tuberosity? This region is your tibial tuberosity. So from the quadriceps tendon, then we have is the patella, and it is crossing over with the patellar tendon. Now the third point says that its main function is to increase the leverage of the quadriceps muscle so that it can function properly and improve the knee extension efficiency. So it helps in the knee extension. While moving upward and downward, it allows the flexion and extension. It also serves to protect the anterior aspect of the knee joint. So any force which is coming from the anterior aspect of the knee joint, let me show you again. So any force coming from this direction, as a bony component, patella is very strong, so it also protects the knee joint. Now then we have is it also serve as the anterior aspect of the knee joint that we already talked about. The posterior surface of the patella is lean with the thin cartilage and articulates with the femoral condyle. So behind the patella we have a very thin articular surface that allows the friction free movement between distal part of the femur, okay, and the patella. So just behind the patella we have a articular surface. Now the common issues include in the patella is patellar dislocation, because patella is very prone for dislocations, chondromalacia patellae, patellofemoral pain syndrome. So any degenerative changes behind the patella surface, which is your articular damage, will lead to your patellofemoral pain syndrome. Now we are going to talk about the ligaments of the knee joint. So we have divided it in two aspects. One is your extracapsular and another is your intracapsular. So first we will be talking about the extracapsular ligament. Okay, so the first ligament is your medial collateral ligament. So as you can see, fibula is present over here. So this is the lateral aspect of the knee joint. So this ligament is your medial collateral ligament, starting from the medial condyle of the femur, and it is attaching to the tibial surface. Okay, similarly over here, as you can see on the other knee, this is your medial collateral ligament. Then on the lateral aspect, as you can see, this is the fibula, again this is the tibia. So the ligament which is coming from the lateral condyle of the femur and it's attaching on the fibular aspect or the fibular head, this is your lateral collateral ligament. Then we have is the posterior surface, we have is the arcuate popliteal ligament. Okay, so as you can see, from the distal posterior aspect of the femoral condyle, it is starting and it is inserting at the superior surface of the fibula head. So this is your popliteal ligament. Now just behind or just below to the popliteal ligament, we have is the posterior ligament of head of fibula. Okay, so this is the posterior ligament of the head of fibula, this one. Okay, and then we have a thick band of the ligament. If we are looking from the lateral aspect, so just from the fibula head, it is attaching towards the lateral aspect of the tibial condyle. We have is the ligament of head of fibula. Okay, so anterior ligament of head of fibula. And then we have a very important ligament, which is your anterolateral ligament. So just in front of your LCL, which is your lateral collateral ligament, we have is the anterolateral ligament. Now we are going to talk about the intracapsular ligament, which is present inside the joint surface. Okay, so here we are looking at the knee joint from posterior aspect again. Okay, so first one, a thick band which is coming like this, this is your anterior cruciate ligament, which is also known as your ACL ligament. And then posteriorly, as you can see, this is your PCL, okay, which is your posterior cruciate ligament. Now most of the time students make mistake while saying that ACL is much more stronger than PCL, but it is not. PCL is much more stronger than your ACL ligament. Okay, now if you're looking from the anterior aspect, what you will see, the ACL is coming like this, while the PCL will be coming like this. So it's almost forming a cross. Okay, they are almost forming a cross in the intercondylar notch area. Now we have a very small ligament which is again very important, right transverse ligament of the knee. So as you can see, it is combined with the menisci. So we will be talking about the menisci as well in the upcoming slides. So this is your transverse ligament of the knee. It is present in the transverse surface. Okay, a very small ligament, transverse ligament of the knee. Now we are going to talk about the meniscus or the menisci. So I have removed the femur bone from here just to make sure you can appreciate the entire menisci region. Okay, so as you can see, this is your C-shaped medial meniscus. Okay, and here we have is a round surface of the lateral meniscus. So why this is medial meniscus? Because fibula is present over here. So this is your medial surface and this is your lateral surface. So what is the function of meniscus? They help into shock absorption. Okay, so they reduce the force coming from the above body and they almost work as like a cushion. Okay, so this is working as a cushion for the knee joint, a soft area that allows a beautiful movement and rotation in the knee joint. So they are very important for the knee joint. Most of the times we have seen some kind of small tears in the menisci, okay, which is again very painful. So in that kind of patients, you will see the rotation will be hampered and there will be pain with the external and internal rotation. Okay, so now again back to the menisci. So this is your medial meniscus and this one is your lateral meniscus. Okay, and above this we have is the femoral condyle. Now in this aspect, a very detailed image, as you can see, your lateral meniscus and this is your medial meniscus. What you are seeing over here is your anterior cruciate ligament, and from the posterior aspect this is your posterior cruciate ligament. So the ACL will not allow the anterior translation of the tibia. Okay, it protects the tibia from moving anteriorly, and while the PCL helps to protect the any kind of blunt force coming from anterior aspect, and this will not allow tibia to move posteriorly. So now we will discuss about the anterior compartment of the thigh region, because we have to talk about the musculature around your knee joint. Okay, so these muscles are coming from the above surface and they are inserting at the knee joint area. So first of all, in the anterior compartment, the large muscle that you see over here, okay, let me zoom it. So don't focus on this area, just focus on this thigh. So as you can see, this is a large muscle which is coming over here and the tendon is inserting at the patella superior surface. Okay, so this is your rectus femoris. Okay, this is your rectus femoris. It is coming from your AIIS. The origin is from the AIIS, which is your anterior inferior iliac spine, and it is inserting at the base of the patella. Okay, so this is the origin and this is the insertion, which is the base of patella. Okay, then we have is the vastus medialis. So this one is your vastus medialis. Again, the origin will be your intertrochanteric line. Okay, intertrochanteric line, and it is inserting at the base of your patella on the medial aspect. So you can write base of patella. Okay, then we have is the vastus lateralis, this one. So this is your vastus lateralis. Again, the origin will be your greater trochanter from the femur bone, and the insertion point will be lateral border of the patella. So lateral border of the, or you can say superior patella. Okay, now then we have is the sartorius, which is not a anterior compartment muscle, but we will be talking about the sartorius muscle in a upcoming slide. Okay, now there is one more muscle which is behind your rectus femoris, and it is a very important muscle. So if you look at this image, okay, I have removed the rectus femoris muscle, and just behind it what you will see is your vastus intermedius. Okay, so it is present behind the rectus femoris. If you will remove the rectus femoris muscle, you will see there is vastus intermedius. So it is very easy to name all the muscles, as this one is present on the lateral aspect. So this is your vastus lateralis, this is your vastus medialis, this is your rectus femoris, and just behind it we have intermedius, in between your lateral and medial muscle of the quadricep group. So this is your entire quadricep group muscles. Again, these are your extensors of the knee. Always remember, they will help in the extension of the knee. So now we are going to talk about the posterior compartment of the thigh, and these muscles, as you can see, they are crossing the knee joint. Okay, that is why they are important to talk about. So first of all, this is your entire flexor group. This is your flexor group. This will help you to flex the knee joint. Now first of all, we have is the rectus femoris. This is your rectus femoris on the lateral aspect. Okay, as you can see, this is the midline of the body, so this will be the lateral aspect of the lower limb. So first one we have is the rectus femoris. Now for the rectus femoris, we have two heads. One is your long head and one is your short head. So the originating point for long head is your ischial tuberosity. Okay, and for the short head, it is your linea aspera. Okay, so this is the origination of the long and short head, but the insertion is over the head of fibula. Okay, the insertion point is on the head of fibula, this region. Okay, over here. Now next up we have is the semitendinosus. Okay, so this is your semitendinosus. Again, the origination will be ischial tuberosity. Okay, and the insertion point will be your medial surface of the proximal tibia, Okay, then we have is the semimembranosus. It is a membrane kind of muscle. It is thin sheet, but again a very helpful muscle. So here is your semimembranosus over here, just your medial to the semitendinosus we have is the semimembranosus. Okay, so this one is your semimembranosus. Origination point will be again ischial tuberosity, so it is very easy to remember. Okay, and the insertion point will be your posterior part of the medial condyle of tibia. Okay, this is your the posterior compartment muscles, primarily talking about the flexors. Okay, the muscle that you see over here is your adductor muscle. Okay, so this is your adductor. Okay, and the one muscle which you are looking over here, this is your vastus medialis. So it is on the anterior compartment that we talked about earlier. Okay, so now we are going to talk about the calf region. As you can see, the calf muscles is also crossing the knee joint, so they are also very important. So if I zoom the image, first of all you will see this muscle which is present on the medial aspect. This one is your gastrocnemius medial head, and this one is your gastrocnemius lateral head. Okay, so if we talk about the origin or the origination for the medial head, this is your posterior surface of the medial femoral condyle. Okay, so posterior surface of medial femoral condyle. Okay, and similarly for the lateral head, this will be your posterior surface of lateral femoral condyle. Okay, so this is the origination of your medial and lateral gastrocnemius, but the insertion point will be, the insertion is over the calcaneus. It is over the calcaneus bone via the Achilles tendon. So if you look at the lower limb, it is somewhat like this. Okay, so here we have is the calcaneus bone. So the calf muscle is starting from here, the lateral head of gastrocnemius and the medial head, and they are inserting over the calcaneus via the Achilles tendon. So this was about the gastrocnemius muscle, medial and lateral. But if you remove the this region, if you remove the gastrocnemius area, behind it you will see we have is the soleus muscle. Okay, this is your soleus muscle, which is again a very important muscle, also known as the second heart of the human body, because it pumps the blood. Okay, it helps in the venous drainage. So the origination for your soleus muscle is your posterior surface of head of upper shaft of the fibula. So it is starting from the fibula, okay, and it is inserting at the posterior surface of the calcaneus again. Okay, so posterior surface of calcaneus again, similar to the gastrocnemius, and the origination point will be your upper head of the, or the upper shaft of fibula. Okay, now then we have small muscles as well in this region. This is your plantaris. Okay, this one is your plantaris muscle, and the one that you are seeing over here, it is your right popliteus muscle. Okay, so its origination will be lateral condyle of the femur. Okay, lateral condyle of femur, this will be the origination point, and the insertion point will be your posterior surface of the tibia. So posterior surface of tibia. Okay, so this is your popliteus muscle. Now we will talk about the lateral compartment. So as you can see, a very thick band that we can appreciate, it is your iliotibial tract. So it will start from the iliac crest, from the innominate bone, and it is coming over the lateral aspect of the tibia. So it is missing the fibula and it is coming on the lateral aspect of the tibia. Similarly, if you look in front of it, this is your lateralis, the vastus lateralis we already talked about, and this one right here is your biceps femoris. Okay, on the posterior compartment, but it is also visible from the lateral aspect. So this one is your long head, and this one is the short head of your biceps femoris muscle. The one thing which we have missed is the medial compartment, okay, or the inner thigh region. So the long muscle that you see over here, it is your sartorius. Okay, this is your sartorius muscle, and is crossing like this, and it is coming over the medial aspect of the knee joint. So the origination will be, see the origination ASIS, okay, the anterior superior iliac spine, and the insertion point will be your medial surface of the proximal tibia. So medial surface of proximal tibia. Okay, then we have is the gracilis. So the muscle that you see over here, this one is your gracilis muscle. It starts from your inferior pubic rami. So here we have is the pubic symphysis, and this one is the inferior pubic rami. So from here we have is the gracilis muscle. Again, it will insert at the medial surface of the proximal tibia. Okay, and then we have is the semitendinosus. Sometime we cover the semitendinosus muscle as well in the medial compartment. And now we are going to talk about the bursae of the knee joint. So first one is your suprapatellar bursae, which is present on the superior aspect. So that is why suprapatellar bursae. Then we have is the pre-patellar bursae, which is in front of the knee joint. So it is known as your pre-patellar bursae, this one. Then we have is the subcutaneous infrapatellar bursae. It is just below the patella. So this is your subcutaneous infrapatellar bursae, and this one is your infrapatellar bursae. Okay, so these are the prime bursaes of the knee joint. Now let us talk about some of the prime movements available in the knee joint. So first, as you can see, flexion and extension. So when it is going down, it is flexion. When it's coming up, it is extension. Next we have is the external and internal rotation. So when the foot is going in internally towards the midline, it is your internal rotation, and the other one is your external rotation. Adduction means when leg moves towards the inner side, when abduction is away from the midline. Okay, so these are your abduction and adduction. This video, do let me know in the comment section what are the other topics you want to learn. If there is any kind of doubt, again you can let me know in the comment section. I have given all the origin and insertion in the description of this video, and do not forget to subscribe this channel and do follow Physioalchemy for more such content.